Hello, everyone. Welcome again to the Rare Minds podcast. So, this month is November, or Movember as we're calling it now, and we thought we'd put the focus in Rare Minds on men's mental health and well-being. For those of you who haven't come across Movember before, it's a month-long campaign that encourages men to grow moustaches or mows and engage in activities to raise awareness about men's health, including mental health, well-being, and suicide prevention. In the general population, the statistics around men's mental health are not particularly good. Men are less likely to seek help for emotional well-being, and they're also sadly more likely to die by suicide. The reason many men face pressure on their mental well-being is often complex and unique, as we're all individuals. But there may include wider, more general pressures on men too. These include the ways in which men experience economic or workplace uncertainty, perhaps a little differently to women. And there are a lot of big societal changes around at the moment too that I'm sure you're all aware of around gender and gender roles. And some men might find that liberating, but others might find it very challenging too. And I think we can all agree there's still stigma attached to men being able to talk more openly about how they're feeling to each other, or even in close relationships, such as with a partner. As a result, we know that men are less likely to approach for help with mental health and well-being and may turn towards alcohol, drugs, or sex to cope instead, all of which can negatively impact relationships, which in turn can then become compromised or break down as a result and cause more distress in the long run too. It's also interesting that although there are some leading lights in the rare disease sector of men, it won't have escaped the attention of many of you listening to this that we tend to encounter more women than men at community events and patient conferences. And in Rare Minds, we're very mindful of how men are accessing our services less than women too. This is often the case with counselling and wellbeing services generally, and something we'd really like to work on and improve over the coming years. So I'm really delighted today to welcome our guest, which is David Ross. David Ross is a rare disease leader in the area of men's mental health. He runs an international men's support group focused on mental health for men across the rare disease community, and is also a member of Rare Minds Lived Experience Advisory Panel. And David is himself a dad living with the rare condition Cowden syndrome. So welcome, David. Thank you for coming on today.
Hi, Kym. Hi, everyone.
Oh, nice to have you on, David. So, David, could you say a little bit more about what led you to set up your support group and how it works?
Yes, certainly. So I was diagnosed with my rare condition in 2017. This was something that was, well, at the time it was a diagnosis of Cowden syndrome, P10 hematoma tumor syndrome. I think it's now comes under that umbrella. At the time I was diagnosed, I it was a month after my mum passed away, and sorry, a year after my mum passed away, and I was still kind of grieving my mother, but she passed away due to thyroid cancer and being diagnosed with the disease at a later point in her life. And so about a year before she passed away, she gave me a letter to give to me should I want to get tested, and it wasn't until after I got tested that I was found to it wasn't till I was found to have had the had Cowden syndrome. So I think when I got diagnosed, I quickly became aware of a lot of amazing female advocates in the community, but there didn't seem to be any men. In fact, when I got to know some of the people in the in who had the same rare disease as me online and in support groups, I found that they were actually suffering in silence, unable to seek out and seek support. So men were going through things, they just weren't really speaking out about it. So it wasn't till about 2020 I kind of like was thinking, how could I make a difference in the community? How could I do something that I didn't feel really was being done? And I set up a men's mental health support group on Zoom, I kind of felt that was something that was lacking. And I made it for male patients and caregivers impacted by rare diseases around the world.
Mm-hmm.
So
It's a tremendous
it started off
initiative.
like, yeah, thank you. Yeah. So I started off making it once a month, posting about the meetings online, and just opened it up to anyone around the world who was like impacted by a rare disease. So yeah, it's been going over 4 years now. Um, it, it's been an amazing experience. It's been hard at times, hard to keep it going, but I think
Mm.
I always find when I finish my meetings, I always feel, well, it's a good thing that I'm doing, and I think it's something that's needed. And sometimes I get something out of it myself in terms of from my own mental health and well-being.
Mm. There's something very rewarding, I think, about taking a difficult experience, and this is so common to those in the rare space, isn't it? Taking a really difficult experience and being that thing that you wish had been available to you at other points in your life. And it feels like you've done this with the support group. You've gone, actually, I would have appreciated something like this. Why is it not happening? I'm going to make this possible. And although there's a lot of work in that, it's incredibly rewarding to do too. And I think there's that real drive in the rare community, isn't there, to kind of make a difference to others who are isolated in the ways that we can recognize others are. So it sounds like you had quite a difficult kind of diagnosis experience, actually, David. And I'm thinking, I know in the work that we do in Rare Minds, that often comes up quite a lot for people, how the experience of diagnosis went for them and how that can then impact on how they feel about their condition over time. And I wondered if that's a theme that gets explored at all in the groups that you run. Is it something that men use the group to talk about, or what are the themes that come up in the group?
Um, yeah, so we have now like 2 meetings a month, and some meetings we have a speaker come in to share their story, but other meetings we would have open discussion. And some of the themes that have come up have been being a rare dad um, to a child with a rare disease, bereavement, losing a family member, and in a few cases losing a child, shame. How shame has been something that's come up. Feeling ashamed of having a rare condition, how that impacts relationships between family, friends, and sometimes in the workplace. And relationships, sex relationships, that's something that some of the guys really feel they need to share. And recently about identity, the changing situation around identity, how and the loss around that, how some of the guys have used to kind of do a lot more with their life, used to work, and a few of them don't work anymore because of their condition, and how that impacts them about and how they feel about they're not unable to do the jobs around the house anymore. They have to. One guy said at at the last meeting about, now I have to pay someone a lot of money to do a job not to the standard that I'd like it, and how that impacts him. So you really kind of it's about kind of life around with a rare disease, really, and how it impacts the guy's mental health. So it could be a number of other topics as well, but how living with a rare disease impacts your life.
Yeah. I think there's a lot of things you've touched on there, but one of the things I'm often quite mindful of when we talk to men through Rare Minds is how masculinity, being male, is often very associated with a lot of energy and a certain sort of strong body, and how if those are compromised for you as a result of your rare condition, it can have a sort of a knock-on effect to how you feel about yourself as a man and as a person, and how those aspects aren't easily talked about with other people. And it sounds like you're making space for that men can talk to other men who get it, who understand that impact of a rare condition, and how the sort of the loss or the grief that can go along with that.
Yeah, definitely. I feel that's quite a big thing. How do men live with their masculinity when they're impacted by rare disease? Or what does that masculinity mean to them?
Yeah.
I think it
Yeah.
brings a lot of questions. But it's good to share those challenges. But also, I feel to share their strengths, because I think it's important to kind of point out that some of these guys are dealing with a lot
Yeah.
and facing a lot, and actually, despite
Yeah.
the difficulties, doing really well
Yeah.
from one point of view or one perspective.
Yeah. That there's different ways of thinking about strong too that are different to the ways in
Yeah.
which the media or traditionally we might have been brought up to think about what being strong looks like, and how important it is to kind of be able to question some of those assumptions that we're brought up with, that I think are still very much around.
Yeah, I think so. I think so too. I think it is something that generally men or society still expects from men. I think some men do see sharing their vulnerabilities as a strength, but I still think we're kind of like, it's still difficult for men in general, I would say.
Yeah, it's not.
Um,
We're not very far away from those days where big boys don't cry, are we? We're kind of in that stage where we're kind of critiquing that idea, but we're still is still around. It's still kind of there. It still kind of doesn't feel quite comfortable for many older generation, but I think also younger too. There are different pressures that it's still not quite cool to talk about your feelings or acceptable. For men in a way that it's a bit different for women who are more used to certain sorts of conversations often.
yeah, yes, I do feel, I do think that's true. I do feel it's like a conversation with fellow rare disease advocate David Rose, and how we talk about mental health, but I don't really share much about my mental health. He used
Yeah,
that as an example, and I,
yeah,
I
we
know what
talk
he means by
around
that.
it. Mm.
Yeah,
I think that's a
it's
really
so.
big, yeah.
I'm sure he won't mind me kind of sharing his kind of example there, and that was what that's so true. I think it's still difficult. I don't think it's always down to older people of my age, middle age, and above. I still think for younger people, it's still something that is to an extent challenging.
Yeah. And it's a big subject, isn't it? When we sort of say things like, are you talking about your mental health and well-being? Well, what does that mean really in practice? Very often it's talking about the ups and downs of, oh, I'm not sure about this, I'm feeling anxious about that, and am I doing okay in this way, or I'm feeling low, or talking about our mental health and well-being is quite complicated, because it often means we have to articulate and reflect on ourselves in a way that sometimes it's easier to kick into the long grass or go and do something else. Or my late partner used to have a a saying that men used to ask each other how they were doing by saying, "Did you watch the football last night?" And the sort of sub phrase of that was, "How are you? Are you okay?" But it came out
Yeah.
in that question. And it's interesting, isn't it? It sort of has to be indirect. But do you think that's still true? The way men kind of don't ask directly how you are, they kind of ask about stuff.
Uh, I think that's there's still an element of truth to that for men. I think, yeah, I think kind of what you touched on earlier, how women are more open to discussions around mental health and well-being. It's still
Mm.
not a natural thing for men to generally ask,
Mm.
"How are you? How are you feeling?"
Yeah.
It still feels something that, for a number of reasons, that, there are barriers around that. I mean, I think a lot of men kind of
Mm.
are busy, being working or being caregivers,
Mm.
and it is a hard one, really, for men to kind of make time to talk about these feelings. I mean, speaking
Mm.
from my recent experience having a counsellor, I've been journaling more, but I've had to make the time for that, and
Mm-hmm.
and that's something that's been a challenge
Yeah.
as well. I mean, it's been great, the journaling, and actually, I haven't had to make that much time, but I think
Mm.
naturally, yeah, I think there's things that men kind of don't barriers or don't make time for,
Yeah.
and
Yeah.
stigma kind of that prevents it being as natural for as women. Talking about emotional,
Yeah.
mental well-being.
Yeah. One of the things that or we hear within the work that we do in Rare Minds is how men and women can sometimes feel, I'm not quite sure the best way to put it. When you have a child and your life is turned upside down by having a child ordinarily, and you have a child that is born with a rare condition, it's sort of doubly turned upside down. And one of the things that we've noticed in with the men that we talk to is that, in any when you have a first child, there's a kind of reworking of the couple becoming a three, isn't there? But it seems to be harder for men who have a child with rare condition, in that there's often a lot of healthcare needs of that child, and a mum may step in quite heavily to support child, and men then sort of feeling a bit on the outside, or a bit like the sort of the spare parent, as someone put it to me. And I think men when they have a child who's born with a rare condition can also doubly struggle to work out their role as dad, or but also how to be a partner. What does that look like now? And feeling sometimes they're on the outside. There's mum and child, but sometimes dad can feel a bit like he's not sure of his place. Is that something that you recognize in your groups, or?
I definitely feel I can relate to some of that, as having a child myself, and I'm remembering back to those
Yes.
early days, the changes around that. It's not just having a child; it's the changing your relationship.
Mm.
Yes, it's something. Yeah, it's something that has been talked about in the men's group, but not much really. Uh, um,
Mm.
it's something that I think one of the reasons why is, I think, probably the men that come on who are dads to rare disease children. They're probably talking. They seem to talk more from the perspective of being the parent rather than being the person as well. And
Yeah.
I think, that's something that I haven't really can't really recall really hearing much about how it impacts their relationship
Mm.
with their partner.
I think that's really interesting, because my hunch is those men that do step into the rare space, they're often there as parents. they're not there so much as, say, partners. They're either there as affected people themselves, or they're there as a parent. But the partners, for example, to those who might have a rare condition, that feels it gets a bit lost sometimes. And also how, when you live with a rare condition, how it impacts on your relationship with your partner. I think we're often a bit more private in certain ways about what goes on in our couple relationships, aren't we? It's somehow more acceptable to talk about the challenges to parenting, but sometimes it can feel more difficult to talk about the challenges in a relationship between a couple, about, how is it affecting your relationship? How is it affecting your sex life? How's it affecting how you get on with each other if you've got very different coping styles? Or that stuff, I think, is sometimes harder to touch on.
Yeah, I would say so. I would say, yeah, I would say for the men, it's very much about the children, when the
Mm.
dads that have come on meetings. I mean, I know there's one regular dad who he's separated from his ex-wife and mother, so he kind of talks about, the challenges around the mother not living in
Mm.
the same house, and kind of living with,
How you
far
co-parent in
enough
different
away.
places.
Yeah,
Yeah.
so you kind of get some of the some of the relationship issues with the former parents, but not much,
Mm.
not really the emotional, intimate side of the actual partner who you're living with. I think, again, I think for me, it's still, yeah, that's an interesting kind of, you brought that up, because it kind of implies that it's still kind of
Mm.
difficult for men to kind of talk completely about how they feel,
Mm.
and how it's being a dad to a rare disease child impacts them as a whole.
Yeah, 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 yeah. Because we know that it sort of impacts. When you have a child who's born with a rare condition, it infects relationships across the whole family, doesn't it? It kind of throws everything a bit up in the air, and then you have to work out how everything fits together again. And people have different opinions and different thoughts about what you should do, what you shouldn't do, and there's a lot that gets put in the mix when you have a child. Well, anyway, when you have a child with a rare condition, it's plus plus, I think. um, and I think that's even more so when you go through adolescence, isn't it? And how dads navigate that period of adolescence with their children, I think, can be quite challenging, when they start to sort of say and have opinions about their rare condition, or how they want to manage it or not manage it. And I think there could be times a lot of conflict there, and challenging for everyone. I don't know whether that's something you've been through or gets discussed in your groups too.
Yeah, I would say, yeah, it is talked about to some extent, and it is talked about from my own experience. Yeah, it has been kind of something that was hard, being a parent to a child
Mm.
who doesn't have a rare disease, but
Mm.
sees me going to hospital, worries
Yeah,
about that.
yeah,
And also getting caught up in advocacy, kind of managing your time still as a parent. And I think it is something that, for dads that have rare diseases, there's one particular dad who has a rare disease, but his children don't, and how it's been bringing up children for him, not being able to do as
mm,
much as he'd like to do physically with them, as well as the emotional,
yeah,
mental health side of, um,
yeah,
from the children's perspective of seeing their dad, uh, um, you know, with his
yeah.
condition,
Because it's a
and
natural,
how that impacts them.
yeah, it's a natural instinct we all have, isn't it, to want to protect our children, and to kind of, not have our children worry about us or be exposed to things that might they might find troubling in some way. And I think when you're living with a rare condition that either is sort of increasingly impacting you over time, there can be a lot of, you referenced shame earlier, but a lot of guilt too, that not wanting your children to be exposed to something that other children may not be. And I think we can frame that to our children by the way in which we manage difficult situations around, despite what's happening, look how I'm dealing with and coping with something very positively. But I think underneath that, there's always that little bit of, but I still wish you weren't having to go through this with me, kind of thing. Does that resonate with you?
Yeah, I would say it does. I can, yeah, I can relate to that. Yeah, it's kind of, yeah, it's a mixture of, yeah, there's kind of two almost separate feelings, and you kind of almost in the middle, in between them, kind of like trying to manage life around that.
Yeah.
So it can be, yeah, I think it can be quite overwhelming, whether you have a child who has a rare disease or not. I think it can be quite
Mm.
overwhelming managing it all, and even
Mm.
for
Yeah.
it's hard enough as it is without the added layers of a rare disease.
Mm. Yeah. Well, one of the things that's come up in a few times on the podcast we've done is that question of how you introduce the idea of your rare condition when you're a young man, or when you're dating, or when you're going into a new partnership. That kind of, how do men introduce to potential partners, whether they're male or female, look, I have this condition as part of my life, and I'm just letting you know it. And sometimes I've kind of had the impression that men hold off saying that a little bit more than women do, but I could be wrong. um, and I wonder if it's harder for men to kind of be upfront about that.
I think that's one that has come up with one of the guys who attends the group. How he's dating and being introduced this to partners or the person
Mm.
he's dating, and how
Yeah.
that on one or two occasions that hasn't worked out, and how that's made him feel, and the implications around that. I
Mm.
think that's a real tough
It's a
one,
quite,
and I
it's
think
quite,
that one.
yeah, it's a
I think
really
it's a real
tough one,
tough
isn't
one,
it?
and
Because it's a bit like when you're I was talking to a colleague recently, and they were talking about how they're quite upfront about the fact that they have 3 children from a previous relationship, and for some men that's something they then go, actually, that's I'm not interested. But that's how upsetting that is for her. And I guess there's something similar with men, or anyone who's dating. If you say, oh, actually, I also live with this rare condition, it's seen as something that for some people they may back off from, and how angry making that is, how humiliating it can feel too. So it's a really tricky one, isn't it, when you bring it in and when you don't, how you speak to that.
I think it is, and I would only kind of suggest I think something that you, you will know when that's right to introduce the fact that you
Mm.
have a rare condition to a partner. I think it's something that they should know, but I think it's something that I wouldn't rush
Mm.
into. Give it some thought, and see what sort of person they are. Um,
Mm.
yeah, and if
And
it feels
yeah,
right to bring it, if it's going well generally, you would like to think that the
yeah,
partner would be accepting of their rare condition. So I think there's a number of things there.
yeah. And I guess too, that also depends on how visible it is, how apparent it is when
Yeah,
physically, whether it might be more obvious, you might want to speak to something or not. And I guess, then by default, you might be carrying the fact of your rare condition more in front of you, if you like, anyway. Whereas when it's a more invisible condition, there's it's a bit more of a kind of like, oh, should I say something now or should I say something later? And people have different attitudes towards that, what they're comfortable revealing about themselves up front or not, because we're all a bit different in that regard, aren't we?
Yeah, exactly. Yeah, that's true. I think, yeah, I think it's something that, yeah, if it's more obvious, I think it would be best to explain it because they're going to be naturally wondering. But if it's invisible,
Mm.
oh, maybe one, yeah, like I said, I think if they're that sort of person, if the relationship's going well in general, I think it would be a good indicator, kind
Mm.
of, to share that.
Yeah,
But
don't
yeah,
leave it too
obviously,
long, but kind of, yeah.
yeah,
Yeah.
yeah, yeah. I think kind of like
Yeah.
it'd be right for you as well as your partner to not leave it too long in that case. But I would,
Mm.
yeah, I would personally, yeah, mm, yeah, just kind of
There's a whole
not
podcast on that,
overwhelm or
David, isn't
overload
there, about
someone straight away. Yeah, yeah,
there's a whole really useful podcast on, how and when and in what ways people have opened up about their rare condition to potential partners. Because I know with some of the young people we talk to as well, it's a kind of like, do I want to mention it? Do I not? And, particularly for, I was thinking particularly about with young women and young men, but whether young men find it, particularly hard to say, this is part of my life, this is, may have an impact on how I choose to have children, or I can't have children, or there's a lot that might get brought up when someone is just stepping into that ordinarily really complicated world of dating, isn't there?
yeah, definitely. I mean, we don't really have any younger people at the moment attending the group. We've only had one younger
Mm.
person under 25 attend a
Yeah.
few times. But I should
Yeah.
imagine for a younger person at the start of their life, they must be kind of hard in perhaps a different way. And
Mm.
yeah, brings up some kind of challenges um, that are
Mm.
kind of some relatable to them or younger people. So yeah, that must be yeah, it must be a
Mm.
harder one. Hard in a slightly different way, I would say.
Mm. David, what you've someone who's really been open about your mental health and well-being in the rare space, and you've really flown the flag for the importance of men talking about how they are to each other and the challenges on men in particular. What what would you want to say to those men who might be listening today about looking after yourself and your mental well-being when you're impacted by a rare condition? What's helped you and what would you like to pass on?
I think I would say that whilst I've had counselling before my diagnosis, I would say, in my opinion, that it is something that's essential when you have a rare disease or have a child that has a rare disease. I think there are many added layers that come with living with a rare condition or being impacted by a rare condition. And I
Mm.
think having that support is vital, really. I think whether that be talking to a friend or a partner or family member, whether that be trying out peer support or having counselling or such as
Mm.
such as Rare Minds or counselling for your GP or workplace. I
Mm.
think it really is important because there is a lot to manage, a lot to take on,
Yeah.
and it can get quite overwhelming easily. So I think it's
Yeah.
yeah, it's important to make that time and for the feelings, emotions around a rare condition.
Yeah. That that's something. I think is a really helpful takeaway from you, that, it's important to make time and give space to the different thoughts and feelings that will arise at different times over the course of your living with a rare condition. That it's not kind of just all about diagnosis, or, that different things will come up at different points. And notice when you're kind of perhaps needing a space to work through those a bit. And I often say, for men in particular, I think men find it, maybe do men, I don't want to stereotype men here. Do men find it more difficult to think about the idea that talking can really help you work through something? But I think that's often the takeaway I want to give men, is sort of give it a go. Sometimes you have to find the words, but finding the words can be so helpful in the long run.
Yeah, I think definitely give it a go and see what works for you. And your mental well-being. I think sometimes we have to do things to work out whether they are, or work out what's good for us or not.
Yeah.
But yeah, I think, and it's something that I've got used to now more, talking to men emotionally. I mean, but actually, it's surprisingly more rewarding than what I would ever think. I mean, someone put something to me on the last call. I mean, it wasn't. Um, it was obvious, really, but he kind of said that, like, the importance of having structure when you have a rare condition. Okay, you may not always obtain,
Yeah.
that daily structure thing, but having that structure in place is beneficial. And he comes up with other kind of great tips
Yeah.
and suggestions. And I
Yeah.
suppose that's
Yeah.
like with the group kind of normalizing the challenges that rare men have to face, and then kind of like it's now
Yeah.
normal, and sharing ideas, whether they're new or old refreshed ideas. It's just great to kind of normalize those discussions.
Yeah. And it's back to that thing we often say in Rare Minds: one size doesn't fit all. You have to kind of work out what works for you in terms of supporting your own mental health and well-being. And sometimes we work that out in conversation with others, don't we? That's what's really great about groups like
Yeah,
yours, that people can go, oh, well, I found this really helpful,
yeah,
and someone else
definitely.
can
I
go, oh, I
think
haven't thought of
despite
that. Okay.
different
Oh
countries, cultures, yeah, exactly. I think, like, from my group, I think that what's the amazing thing is, despite different countries, cultures, social classes, those
yeah.
conversations with men are you can take bits of it that work for you, or and leave the bits that are not for you. So that's the great thing. Through those
Yeah.
discussions, I think we can only gain.
Yeah, yeah, absolutely. So, I often get to this point near the end of the podcast, David, where I ask all my guests that come on, what do you do to look after your mental health and well-being? I know you've talked about having counselling recently, and that's been really helpful, but what else do you do to look after yourself?
I think, I think sort of simply, kind of connecting, um, with the community. I think, the men's group is one thing. Music, reading,
Mm.
podcasts, um,
Mm-hmm.
conversations with my wife every day. And
Mm-hmm.
actually, kind of, I've just done a walk by the seafront. So actually, yeah, it's kind of, yeah, a mixture of things. But yeah, that's what
Yeah.
really helps
Yeah.
me.
Yeah. And I think it is that mixture of things, that we often need different things at
Yeah,
different times too. I know some days, if I'm feeling a bit low, I think, oh, I need to sort of curl up and hunker down a bit with a book and a cup of tea, and just give myself a bit of space. And other times I need to talk, and other times I need to walk.
yeah,
It's kind of what's going to lift you at that particular moment in time. And that ability to go back to yourself and, what do I need right now? What do I need
yeah,
right now? Is really important. So,
yeah, definitely. I was,
David, I think I want to go on.
sorry.
No, I was going to say, go on.
Yeah, definitely. I mean, I was just, I had nice to have a day in Sunday where I was like watching travel programs and some. Yeah, it's you're so true. It does depend what's right for you. It does depend on a number of things. So it's good to have a variety of things. Yeah, that's what I was going to say.
Yeah. A travel program is a good one to watch on a wet, windy Sunday, I would say. A bit of escapism. So,
Yeah, exactly. Yeah, exactly. Yeah. Yeah.
so David, if people want to find out more about your men's group, how can they do that?
Yes. If you email men's rare disease mh@gmail.com, I will be able
Mm-hmm.
to send you some information about meetings, or any other things relating to men and mental health. But yeah. So basically, contact me through there.
Fabulous. And we'll put that link in the podcast notes if you're watching this on Spotify too. And we'll also list some other support organisations that are just for men's mental health and some other ones too. So, David, thank you so much for being on today. And, I'm sure you've got other things in mind and we'll be doing for Movember. So, it's good to be part of raising awareness for men's mental health during November with you. So thank you very much for coming on.
Thanks so much, Kym.
Thanks, David. Bye bye. So I'm just going to stop recording.